Hi, my name is Dr. Jamie Adam, and today I'm going to talk to you about fluid and electrolytes. I teach pharmacology, and all the time my students are saying, how am I ever going to remember everything I need to know? So I want to boil this down to just five big things that you need to think about when it comes to fluid and electrolytes. So, number one, anytime we're talking about fluid and electrolytes, we're really talking about balance. Balance is the goal. And how do we know that our patient has achieved balance? Well, we really want to make sure that what's going in fluid wise is coming out. So, if at all possible, intake should equal output. The other thing that we look at is weight. So, weight is the number one best indicator of fluid status. When we check daily weights in the hospital, we're checking to see what their fluid status is. We're checking for changes for to see whether the patient is holding on to fluid or whether they're losing too much fluid and could be in danger for dehydration. So when we see big shifts, if your patient has gained 2 pounds since yesterday, it's not because they've eaten 2 pounds additional food. It's because they're holding water, and that is important information. And so weight is a really important factor in monitoring fluid status. The other thing I want to point out is that isotonic fluids replace water and salt at the same rate. And so the isotonic fluids are the most natural to the body. So, of all the different IV fluids we give, this is the most common type of IV fluid, isotonic fluids. So, examples would be like 0.9% normal saline or lactated ringers. Those would be very common isotonic fluids. And those are going to be the same tonicity, the same salt and water ratio as what is naturally occurring in the body. So that's kind of our go to IV type of fluid that we like to give. The other thing I want you to know, one of those big takeaways that I always talk about in class, is that our number one biggest fear when we administer IV fluids is always the risk of what happens if we give too much? What happens if we push that patient into fluid overload? A patient that is in fluid overload is in danger. Patient could be in danger of dying. So, fluid overload can be very serious, especially depending on the patient. Patients that are really young or really old, or someone with a chronic organ impairment, especially heart and kidneys, fluid overload can be very, very dangerous. So, we're always monitoring fluids and fluid status. When we give fluids, we're checking for signs of overload. We're checking their feet to see if they have any edema. We're checking their breath sounds to make sure we don't hear any crackles in the lungs. We're always checking to see, are there any symptoms that this patient is getting too many IV fluids, they're getting too much, and they're going into overload. And so that really leaves us with that last principle that really fluid overload is potentially deadly, especially in your elderly patients. So, really, really watch fluid status in those patients specifically. I hope this has been helpful. I know that there's so much to remember, especially when it comes to pharmacology. And I don't blame you if you feel overwhelmed in nursing school. I mean, that's how I felt too. So I want to help you. I've created a free ebook. The link is down below. I want you to download that. It's going to walk you through exactly how to study for your next test. It's going to teach you about concept mapping. It's going to teach you all the steps that you need to be successful on your next nursing exam, whether that's pharmacology or any other topic. Thank you so much for watching. Please like and subscribe and share my video. I don't want you to miss any other good content that's coming out. And thank you for watching.